second day of my appointment has promised and has constantly delivered on his promise to fully support PhilHealth. Maraming salamat po, Honorable Speaker Martin Romualdez. With these enhancements, we aspire to eradicate the financial burden of healthcare costs, facilitate timely access to essential medical services, and ultimately elevate the quality of life for our valued members, the Filipino people. We also embarked on a campaign that promotes the provision of primary care services for all our members with the Konsultasyong Sulit at Tama program. The Konsulta program now provides Filipinos with covered benefits such as consultations with medical professionals, laboratory tests, and essential medications. We have accredited 2,943 Konsulta package providers this 2024, and they help us register more than 27 million members to the Konsulta program. More than 6 million of them have availed of their first encounter with their medical professionals. These measures affirm our commitment to making healthcare equitable, accessible, and sustainable for every Filipino. Beyond expanding benefits, PhilHealth remained a guardian of financial protection also. Over 50% of hospital claims are now reimbursed within 30 days on the average. This improvement reflects our dedication to make adjustments for efficiency. In the face of significant hurdles, therefore, including the absence of a national government subsidy in this year's budget, PhilHealth remains steadily on course in its mission. Our plans to continue expanding aggressively benefits in the coming year, in fact, remain unchanged. While subsidies have historically been vital to enhancing the program and strengthening the healthcare system, PhilHealth's financial health enables us to fulfill our obligations and continue providing benefits to members, both direct and indirect contributors. We do wish to manage expectations, but rest assured that for 2024, all benefits will be paid, including those for our most vulnerable members, senior citizens, indigents, persons with disabilities, rebel returnees, and other marginalized sectors. Walang dapat ikabahala ang ating mga kababayan. Sagot po kayo ng PhilHealth. What we can assure in any case is that PhilHealth management will optimize our resources and will safeguard every peso entrusted to us and make sure it is spent effectively and responsibly. While we have made progress, we acknowledge that much remains to be done. Rebuilding trust is not a one-time effort, but an ongoing process. We continue to engage stakeholders from healthcare providers to local government units to ensure that the benefits we promise are the benefits we deliver. We are proud of our milestones at PhilHealth. We also recognize that meaningful reforms require trust, collaboration, and time. PhilHealth is bound by the provisions of the law, and significant changes, including streamlined decision-making, may necessitate legislative adjustments. We are committed to transparency and accountability as we navigate these challenges, with leadership rooted in competence and a clear vision for universal healthcare. All this is to say, universal healthcare is not ours alone to make it happen. As representatives of the people, your support and collaboration are critical for PhilHealth. PhilHealth sustainability hinges not just on internal reforms, but equally important also on a shared commitment to prioritize health as a national agenda. While we are committed to continuing with the reforms we have begun, we hope to be able to rely on Congress to explore solutions, including alternative funding mechanisms that can bolster our capacity to serve the Filipino people. In closing, may I assure this august body that PhilHealth is determined to fulfill its mandate. Despite the challenge, we remain optimistic. With continuous sound management, strategic reforms, and the collective effort of all stakeholders, I believe we can build a PhilHealth that is not just renewed, but truly worthy of the trust of every Filipino. Maraming salamat po, esteemed honorable representatives.
Thank you, Sir Emmanuel Ledesma Jr.
Can we just very quickly show a brief video? Very, very brief, no? This was requested from me just to clarify a few things. It will just take less than a minute, Mr. Chair, with your permission.
The indulgence of a representative from the DOH. Please continue. Please proceed to your presentation, video presentation, Mr. Ledesma.
Okay. Can we? Ma'am, can we just please show the video very quickly? Thank you very much po. Less than 1 minute po ito po. Maraming salamat. Dear members of PhilHealth, in relation to the bicameral conference committee's recent decision not to provide PhilHealth with government subsidy for calendar year 2025, allow me to assure everyone that PhilHealth will continue to pay for the health benefits of all Filipinos, with or without government subsidy. It is our goal to finance the best care and benefits available. The decision of the Bicameral Conference Committee reflects its wisdom. The BICAM understands PhilHealth's capacity to continue managing the National Health Insurance Program given its surplus funds. Our financial position is strong and sufficient to sustain our operations, with a total of 281 billion in reserves and 150 billion pesos in surplus funds as of October 2024. On the other hand, our investment portfolio as of November 2024 already reached 489 billion pesos. We shall do better to provide reasons for the provision of government subsidies, which are vital to ensuring long-term improvement. We are deeply aware of the impact healthcare costs have on Filipino families, and we remain dedicated to enhancing our benefit packages and reducing out-of-pocket expenses so that every patient feels the security of their health insurance. Rest assured, all PhilHealth benefits will continue to be paid and will even improve. PhilHealth stands with every Filipino in our shared goal of achieving universal health coverage and a healthcare system that you can always trust and rely on. Together, we will overcome these challenges and continue to strengthen our commitment to your health and well-being. Thank you very much, Your Honor.
Thank you. May we recognize now the representative of DOH, Assistant Secretary Dr. Albert Francis Domingo.
Thank you so much, Mr. Chair. To our honorable members of the House of Representatives. Thank you very much, Your Honor. Maraming pera ang PhilHealth.
Sir, pakilapit po yung mic.
Thank you so much, Mr. Chair. To the honorable members of the House of Representatives and this committee, maraming pera ang PhilHealth, higit pa sa reserve fund ceiling na pinapayagan ng batas. Ang surplus na ito ay resulta ng mababang pagbayad ng benepisyo sa mga lumipas na taon. Kaya naman ang mga pamilyang Pilipino ay nagbabayad ng mataas mula sa kanilang bulsa. Inaprubahan ng board kahapon ang mas mataas na benepisyo at isang budget para sa 2025 ng PhilHealth na kumikilala na dapat gumastos ng mas malaki ang PhilHealth para mas maliit ang gagastusin ng mga pamilya. Trabaho po ng PhilHealth, Mr. Chair, na bayaran ang benepisyo ng mga miyembro nito. Bilang puno po ng Board of Directors, kasama na rin ng iba pang members ng Board of Directors, ang Department of